Today we're going to cover hair transplantation. Hair transplantation is one of the preferred topics for males, and usually, obviously, we treat what we call androgenic alopecia. Although the alopecia or the hair loss also happens in females, but in a much less degree. So the most common occurrence is in males, and affecting usually between 30 and 50% of males by the age of 50, which is a significant prevalence in the population. So this is so common that we see a lot of patients out of practice looking for improvement, because what happens usually, it gives you a boost on your self-esteem. It makes you more confident. It makes you feel better about yourself. So there is nothing wrong with looking into the different options for hair transplantation. So there are medical treatments and surgical treatments in order to address this topic. So first of all, you had to go and consult with a plastic surgeon that performs hair transplantations, or a hair transplantation surgeon. Once they do an evaluation, depending on many factors, on the degree of balding that you have and on your age and so forth, then they can recommend what's best for you. So let's start for the medical treatment. The medical treatment consists usually in three main things. There are lotions with minoxidil, which is a drug that actually works creating a thicker hair and preventing the further loss of the hair that is falling. And there are medications like finasteride, which is a hormonal treatment. It's a pill that also targets a different set of proteins that prevent or favors the slowing of the hair growth, so it makes your hair grow more. And also treatments like laser combs or laser helmets. All those medical treatments in combination actually prevent the hair loss and help the hair that you have grow further. Now, if you have significant balding, this is not going to be your only solution, and you likely will need something else. The surgical treatment starts with what we call plasma injections, or PRP injections, which actually create a great environment for the hair to grow. Now, this is not just enough, and you likely will need a hair transplantation, which can be performed in two different ways. One is what we call FUT, or follicular unit transplant, which is we take a small portion of the posterior scalp, creates a scar that goes usually on the posterior portion of your scalp from ear to ear, and that area is usually well covered by, even if you use the hair about 1 or 2 centimeters long. But if you are a patient that is used to use short hair, then we recommend to use the follicular unit extraction, or FUE. This is a technique that leaves no scars, although we can transplant less hair per session. But this consists in the transplantation of unit per unit. So we take follicle per follicle from the back and we transplant it to the front. The main concern is to rebuild your hairline, so the front. If you are balding from the front, you look bald, not so much from your back. So if we can reconstruct your front, then we'll first target your front. And if you have enough hair, then we'll do your front and your back. Now, if you're only balding on your back, we can definitely treat your crown area alone. The procedure itself is a procedure that, depending on how many hairs you're going to transplant, but it takes sometimes from 6 to 10 hours. It's a long procedure. It's a procedure that is performed under sedation. You're not under anesthesia. And it's a team approach for this. Now, after that day, the recovery is pretty simple. Usually it takes 2 or 3 days. You might have a little bit of swelling over those 2 or 3 days. And then after that, you're going to see that your hair starts growing. About a month or so falls out again, because the hair follicle cycle resets, and then it starts growing again by the second month. And then by the time of a year goes by, you should have about an inch of length of hair. So if you want to learn a lot more about hair transplantation, visit MagicSurgeon.com, and then share this video if you like it, give it a thumbs up, and remember, believe in magic.